Cardiac assessment, okay? So the patient's laying down in the bed. We're gonna move on to abdomen. This is your abdomen checkoff. We did give you this handout, and it's the tools of physical assessment. And if you'll look down here at the bottom, it says abdominal assessment is different. We go in a different order, and I will explain that to you. What we're going to do first is that we are going to inspect, and you'll actually lift the shirt or the gown and inspect and look at the abdomen. You're going to look for symmetry. You're going to look to see if you see any pulsations. Their skin, you're always doing a head-to-toe skin assessment. So you're looking at their skin, you're looking for scars, anything like that. So inspection is first. You look first and you don't touch. Then, because it is bowel, our next step is auscultation. Okay, so you inspect and then you immediately auscultate so that you don't disrupt the bowel sounds by pressing on it. After you listen with auscultation, you're going to start in the right lower quadrant and move around just like the bowels do. Start over here, right lower, up, just around, just like the bowels move. And that is how they move, right? Ascending, transverse, descending, and out. Okay. Then you'll do palpation, light palpation, which is about 1 centimeter deep, and you do it in the same order, and then a deeper palpation, and then you can do percussion. Okay? Any questions on that? Okay, so we'll start that. Ms. Myers, I'm going to do an abdominal assessment on you.
Okay.
I'm going to look at your belly. My hands are cold, I'm sorry. So I'm looking at her skin. I see no pulsations. She has some moles, and you could talk about that now. She is fair-skinned, and you would want to talk about anything about any lesions. I'm going to look for any scars. Have you ever had surgery?
I've had 2 C-sections.
Okay, so I'm not going to show y'all that, but I would inspect her scar. And then, so everything looks okay. All right, so now I'm going to auscultate. Remember, you start on the right lower quadrant. For bowel sounds to be absent, you have to listen for a full 5 minutes by the clock, okay? Bowel sounds are present in 4 quadrants. What would happen if I had started palpating? It would start the peristalsis, right? And would that be a true assessment? No, it would be something I intervened on, okay? So you look first, then you listen on the abdominal assessment. Okay, and then I'm going to start light palpation. That's about 1 centimeter. And you do it in the same order. So when I'm doing this, I think about, what am I palpating? Well, I'm palpating down here, her appendix, right? There's an appendix down here. Have you ever had an appendectomy? You still have your appendix?
I do.
Okay, if you feel any tenderness or pain, let me know.
Okay.
Up here's a liver. Do you still have your gallbladder?
Yes.
Okay. And when was your last bowel movement?
Yesterday.
Okay, was it normal for you?
Yes.
Okay. Do you have any pain when you urinate?
No.
Do y'all see that? I went in order. I'm talking about her bowels. And then here I'm over a bladder. There's a bladder in there. Over here there's ovaries. So when I'm deep palpating, when was your last menstrual cycle?
Oh, a week ago.
Okay, and about how long does it last?
5 days.
Okay. Any pain with palpation?
No.
Okay. So you think about, what am I listening to? What am I feeling for here? And you can ask the review of systems questions while you're there. Does that make sense? Okay. And then I'm going to percuss. And it's the same method that Miss Anderson showed you for the lungs. There you go. So it's going to sound tympanic, right, over air, or open, and it could be dull over something that's solid. So it could be a solid mass, it could be stool, it could be an organ. So you just listen for the sound. You'll hear the difference there. Okay. All right. So it was tympanic over here, and it got a little bit dull. And you remember, I'm going in order here. Okay. If I'm over an organ, if you're up here and you hear some dullness, you can assess the liver. You have them take a deep breath in, and you feel for the edge of the liver. Y'all do not have to do that on your checkoffs, but that's at this point is when you would do that. Okay. And then I will have her sit up, and you can face away from me. Really, in a physical assessment, in the flow, you would do this at a different time, but as part of when I asked her about her bowels and her menstrual history and her OB history and her urination, then I'm going to come back here and check CVA, or costovertebral angle tenderness, and that's a kidney assessment. So I get between her ribs and her hip bone. Tell me if this hurts. Any pain? No. Okay, and while I'm back here, I'm still assessing for spinal alignment. I'm seeing no signs of dyspnea. It's just a constant assessment. Okay? All right, and then we're going to move on to musculoskeletal. And for musculoskeletal, first you're going to inspect. So I'm going to inspect upper extremities and lower extremities. Yeah, come on down to the end of the bed for me if you don't mind. So right here, you inspect and assess range of motion in 2 joints of upper extremities. Can you lift your arms for me? And down. Okay, and can you come forward and down? I feel no crepitus. And I'm going to check her elbow. There's no crepitus. Here's a joint. Can you? Okay, so she has full range of motion. And I feel no crepitus or crackle in those joints. So here's an upper extremity joint, here. Okay, you've got to assess and inspect range of motion in at least 2. Can you squeeze my fingers? Okay. Can you push against my hands? Okay. Thank you. All right, and I'm going to move down to her lower extremities. I'm going to lay back on the bed for a second. You've got to do 2 lower extremity joints. We have a hip joint, we have a knee joint, and we have an ankle joint, right? Can you lift your leg up and down? Okay, and this leg? She has full range of motion in her hips, and how about your knee? So, she has popping in her left knee. She has popping in her right knee. Have you ever had an injury in your knee?
Not too bad.
Okay. And then your ankles? Okay, there's a little popping there. Okay, so bilaterally, she had full range of motion in all of her joints. In bilateral knees and bilateral ankles, there was some crepitus. All right, and then I need to inspect her strength. So while I'm down here, and remember, I'm constantly doing an assessment. While I'm touching her, I'm looking, I'm feeling. Is there edema? Is it warm? Is the skin taut and shiny, or is it normal color for their, ethnicity? So I'm still doing all of that. I'm going to check her Don't kick me over.
I won't.
Strength. Push against me. Pull. Pull against me. Okay, good. And your feet? Okay, good. And her strength is equal in all of those joints. I mean, and then, this is where I'm supposed to inspect her back alignment, but I would have done that, and I said that, I think, already on the CBA tenderness. I see that she is sitting up straight, her shoulders are level, her spine is straight down, her hips are level, so her alignment is normal. Does that make sense? So if she was sitting off like this, or I could see the spine, so in your patient that you do this on in the hospital, you're actually going to have to look. They'll be in a hospital, yeah. Okay? Did I get it all? Yeah. Okay, any questions?